According to the World Health Organization's estimates, the number of diabetes patients worldwide is expected to reach 780 million by 2045. This makes diabetes a global health challenge. National Cheng University, NCKU, possesses a strong foundation in medical research. The NCKU Hospital offers a comprehensive healthcare system. Inheriting the mission of Taiwan's diabetes research pioneer, former Superintendent Professor Tong Yuan Diabetes, NCKU established the nation's first specialized diabetes research center. Professor Tong Yuan Diabetes was our first superintendent. Many of his mentees are now conducting diabetes research at NCKU, exemplifying a legacy of knowledge transmission. In essence, we are preserving and building upon the contributions made by the first, second, and third generations of diabetes researchers here at NCKU, and to inspire these students to carry forward his mission, extending its impact further. It is important to raise awareness among the public that in an aging society, managing diabetes and metabolic control is especially important. The establishment of Tong Yuan Diabetes Center is not merely focused on translational diabetes research and medical technology innovation. It is also dedicated to strengthening connections among industry, government, and academia, as well as creating a technology transfer platform. This ensures that research and development results are applied in clinical healthcare to improve the medical care and quality of life for diabetes patients.
Our Diabetes Research Center is primarily divided into three areas. The first is translational medicine, which encompasses both basic and clinical medicine. This approach requires several models. First, we have cell models. Second, animal models. And third, human studies. Another key area of focus is medical policy, as ultimately, diabetes care must center around people. The research outcomes need to be practically applied to improve real-world health outcomes, which involves improving clinical policy development. The third aspect is closely related to aging. Diabetes has a strong connection to aging, so we have a department focused on geriatric health education. This department includes many faculty and medical professionals from College of Medicine in NCKU, NCKU Hospital, and other academic departments, all working together under Tong Yuan Diabetes Center's collaborative platform.
From the laboratory to the clinic, every stage is critical. Tong Yuan Diabetes Center integrates fundamental research with clinical practice, combining interdisciplinary collaboration and specialized care. This approach ensures medical innovations provide a strong health safeguard for elderly patients. Geriatric medicine, also known as elderly medicine, is a multidisciplinary field that spans a variety of scientific disciplines. One of the common challenges faced by the elderly is the presence of multiple comorbidities and a decline in functional capacity. Therefore, providing effective care for elderly patients requires extensive collaboration across different specialties and professional fields. The Institute of Gerontology at NCKU employs this multidisciplinary approach to enhance geriatric medical care, long-term health care, and life care services, ensuring more comprehensive support for older patients. The treatment of diabetes relies not only on advancements in medicine, but also on policy support. Policies informed by medical evidence can make diabetes prevention and treatment more efficient. This not only benefits a greater number of diabetes patients, but also helps reduce the nation's healthcare cost burden. My primary responsibility is to evaluate all clinical guidelines to assess their cost-effectiveness. We analyze the health outcomes achieved by every dollar spent by the National Health Insurance. Our aim is to identify the most effective and practical preventative measures that people can readily accept. Prevention can have a significant economic impact, enhancing individual earnings, reducing the nation's GDP loss, lowering healthcare expenses for the National Health Insurance, as well as shortening periods of disability for individuals. Future diabetes research will not be limited to physical health, but will also encompass psychological and social health. Through comprehensive exploration, Tong Yuan Diabetes Center aims to create a healthier, more hopeful future for every patient.
Diabetes and health encompass three major aspects. The first is diabetes and physical health. The second is social health. And the third is mental health. We hope to explore diabetes from these three aspects, with the goal of elevating Taiwan's research to newer heights. We believe that more research outcomes covering an increasingly broad range of topics will emerge in the future. This has been the guiding principle since the establishment of our center. We encourage collaboration among various research teams on this platform. This collaboration will ultimately enhance the health of our entire population while effectively reducing overall medical expenses.